Welcome to another edition of the SABC News COVID-19 Global Wrap, where myself, Babalola Phaka, and my colleague Busisiwe Khatebe bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. Over 30 million cases have been confirmed globally, with over 22 million recoveries and over 950,000 deaths. South Africa currently sits at over 655,000 confirmed cases, with over 585,000 recoveries and over 15,700 deaths.
In South Africa, President Cyril Ramaphosa has announced South Africa's move to Alert Level 1 of the lockdown from Monday morning. Among other measures in place, gathering capacity has increased, while the ban on international travel has also been eased under strict conditions. And lastly, Health Minister Dr. Zweli Mkhize says studies indicate that an estimated 12 million people may have contracted COVID-19 in South Africa so far. As the country records a steady decline in new infections, Mkhize says revised models predict that there are South Africans with detected and undetected COVID-19 infections. On to the rest of Africa. The continent has now recorded over 1.3 million confirmed COVID-19 cases with over 1.1 million recoveries, and the death toll stands at 33,484. The World Health Organization says there is increasing evidence that Africans living with non-communicable diseases such as hypertension and diabetes are more likely to suffer severe cases of COVID-19 and die. According to a WHO preliminary analysis of 14 countries in the African region, hypertension, diabetes, cardiovascular disease and asthma are the comorbidities most associated with COVID-19 patients. In Nigeria, health workers demanding a danger allowance for treating COVID-19 patients have gone on strike only a week after doctors in Africa's most populous country staged a walkout. Meanwhile, medics in Morocco handling a surging COVID-19 outbreak have staged protests against inadequate staffing and poorly equipped facilities. And lastly, medics working in war-ravaged Libya's few functioning hospitals faced their nightmare scenario, which is a surge in cases and dwindling resources.
And in international news, United States President Donald Trump said a COVID-19 vaccine could be 3 or 4 weeks away and could possibly be ready for distribution before the November 3 presidential election. His statements, however, come despite caution by U.S. health officials over a rushed timeline. And as the election draws to a near, Trump encouraged fellow Republicans to go for higher numbers in a COVID-19 aid bill. This as Washington remains deadlocked over economic relief from the crisis. In Latin America, experts in Rio de Janeiro and Brazil warned of a second spike in infections following the reopening of bars and beaches. Epidemiologists fear that the reopening may have come too soon, adding that part of the problem was Rio's decision to ease restrictions, partly based on incorrect data, which showed a decline in COVID-19 related deaths. In Asia, Japan has committed 17.2 billion yen, or $165 million in funds for its participation in the World Health Organization COVID-19 vaccine program. And in rural Indonesia, local authorities are forcing villagers refusing to wear masks to dig graves for virus victims, with hopes that a bit of manual labor and empathy will convince others to play their role to help stop the pandemic. And finally, in Europe, the number of people in France being treated in ICU units for COVID-19 rose for the 20th straight day on Wednesday amid rising infections. Meanwhile, countries across the European continent are imposing harsher restrictions to curb the spread of the virus after a sharp spike in cases.
For the latest updates on the coronavirus, visit sabcnews.com.